Can everybody take their seat, please? Chief? All right, so the meeting has been called to order. Everyone's got their seat. Marnie, can you do roll call, please?
Yes. Director Gould, Director Stark,
Present.
Director Weber, Director Costa,
Present.
Director Clark,
Present.
Director Rice,
Here.
Director Jones.
Here.
Thank you. Directors Sailors and President Wood are absent this evening. Thank you.
All right, thank you. Director Stark, will you walk us through the pledge, please?
Will do.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Director. All right, the Metro Cable announcement of when this meeting is being recorded is on the second page of the agenda. So with that, we'll go to public opportunity to discuss matters of public interest with the districts within the jurisdiction of the district, including items on or not on the agenda. Do we have any speakers?
I have no speaker cards. Does anyone in the audience wish to speak? Please come up to the podium. If you're online, please use the raise your hand feature. No response, no public comments. Thank you.
All right, thank you. That takes us to consent items. Do we have any questions on consent?
Mr. Chair, I make a motion, we adopt consent as published. And I'll second.
All right, we have a first and second. Roll call.
Aye.
Director Stark,
Aye.
Director Clark, Director Rice, Director Jones,
Aye.
Director Weber,
Aye.
Director Costa.
Aye.
Thank you. Motion passes.
All right, thank you. So that brings us to presentation items. The first item tonight is cancer research and prevention. And do we have Ms. McKinney here? Oh, please. Thank you. Come on up. And Director Rice.
Good evening, everybody. I want to introduce Misha McKinney. Misha works for Kaiser Permanente. She is the Vice President of Patient Services, specifically in oncology. And that Vice President's position is across Kaiser, not just Northern California. We're here tonight because two reasons. CPF has had a very in-depth relationship with KP in behavioral health. And out of that, I met Misha, she met Chief House, and we spoke at a conference in Chicago on firefighter wellness and cancer risk and cancer awareness. And shortly after that, Misha approached me and said, Brian, KP would like to do a research study of firefighters to include CPF and California Kaiser Permanente members. And I'm not even going to try to explain the research study. I'm going to let her do that. But I can say this, that is, we went through this process. We're working on finalizing our LOI. And there was two things that I needed. And one was we have labor support. We've got KP as a partner, but we needed organizational support. And that's what brings me here. I'll let Misha talk about the study itself and answer any technical questions, and then I'll close it up.
Good evening. We did have some slides. I'm not sure if those are available. If they are, that'd be great. Otherwise I can. Oh, fantastic. Thank you so much. So I'm very happy to be here on behalf of Kaiser Permanente. I am part of the National Quality program at Kaiser Permanente, and I work in close partnership with many employers and groups. And we're so fortunate to have this opportunity to partner together. Chief House and President Rice and I have been talking about this for almost a year now and thinking about ways that we can make it better for the next generation of firefighters. If you could go to the next slide, we'll be able to walk through the three major components of this. So oh, I have it.
Right on your right.
This one, got it. Got it. There we go. All right. So the intention is really to look at how we can improve the health and longevity of California's firefighters and looking at some long-term research and understanding risks that are associated with exposure. And this focus came through some conversations that we had. We were actually in this building sitting around a table, and I believe it was Chief House who said, does Kaiser Permanente do research? And the answer to that is yes. We actually have 9 research divisions across the United States, and the largest of that is in Northern California. So we do drug cancer research. We do types of cancer care delivery research. We do quite a bit of work in population health and absolutely in the space of cancer prevention, which is really an area that we excel in. So we have 3 components of this. So the first is we really need to start with a registry. And that would include all of the KP firefighters. And this is important because once we have a registry or a base of data that we can work with, we can then take that and start to understand the types of, start to, get answers to the questions that we have. Is there an association with a certain type of exposure to a certain type of cancer? Do we have the correct screening recommendations for firefighters? So that's piece 1. That is the foundation of all of this. The second part is in conjunction with the Kaiser Permanente Research Bank. So this is a database that has been in existence for about 20 years. There are about 40,000 people who are in this research bank, and they can do very specific genetic workup. And the proposal was to look at telomeres. So telomeres are part of the chromosome that as you age, it gets shorter and shorter. And it can be a sign of premature aging, which can lead to cancer. And so the thought was, what if we were to look at the telomeres of firefighters, and what would that tell us? Are there certain biological aging features that are impacted by the types of exposures that firefighters have? So it's a really, really interesting sort of hypothesis that would be, I think, fascinating to look at. And then finally, there's another piece of this, which is a partnership on prevention. This is not a research study. This is really focusing on screening, wellness, health promotion. And so that would be with all firefighters across California, not specifically with KP members. So it would really be creating, first starting with human-centered design. So understanding what are the most important things to firefighters in terms of promoting their own health, and then how can we collaborate to build together. One thing I want to say about all of this is that there will be a group of firefighters who are part of a collaborative that are going to help to guide all of this research. And it's really the idea of doing nothing about me without me. So we would have a team, a core group of firefighters who would help to, from the very beginning, look at the way that the study is being designed, how we would recruit people, the types of promotional materials that we would send out to make sure that it really is addressing firefighters' needs, that it's speaking the right language. I'm a nurse. I'm an oncology nurse. I worked a lot with firefighters when I was doing direct patient care. Many of my nurse colleagues are married to firefighters. So I think it's really important for any time that we do research that we really build it collaboratively, and it's not, I think in healthcare sometimes, there's this trend to be like, we'll do it this way for you. But I think this is an opportunity for us to be more collaborative and do it in partnership together. And that was we were going to do the prevention partnership together, but this was actually something that Derek Irwin had suggested that we do. And so we really embrace that. So I'm going to stop here and see if you have any questions.
So are you able to capture any data that through UCD? We've had a recent study there as well. I don't know how deep we are into it, but I know we've had some of our members wearing the bands and collecting data as well.
Right. So there are actually a number of studies that are happening across California. So this is separate. we've done a literature review to look at all the other concurrent work that's been done to date. And then, so this is, just correct me if I'm wrong, but that one is looking at wildfire exposure specifically. So this one is, building that registry so that we can test a number of different things. But we're really looking, I think, at exposures and then what types of screening might be appropriate and being able to answer those sorts of questions. So the research aims are slightly different than the one at UC Davis. Mhm.
What about the funding? I mean, are
Sure.
we doing that through grants, or how are we gonna fund these studies?
Sure. This is actually being funded through the Core National Cancer Care Services at Kaiser Permanente. So it's coming from KP. So there's that, and that's coming out of my cost center. So we've got control over it. Yeah.
Perhaps it's in here somewhere and I missed it. How do we get our group? How do we as firefighters come to you and say, here I am, poke
Sure.
me, take a sample, whatever?
Director Jones, so there's a lot of components to this. KP is the medical and the research component. I asked Chief House, and actually the Cal Chiefs, I asked Cal Chiefs to appoint Chief House. We needed an organizational component and we need a labor component. And so I think your question goes to, how do we notice our members? And there's a couple of asks that are coming your way. I'm not going to jump ahead of that. But what the CPF is going to do in this partnership, we have the direct access and the data to the members. I am also going to put all communications and then administrative technical support on the other side of this. There will be an ask of Metro Fire to participate in kind of an oversight and a guiding spot. Hopefully, maybe I have a group called Wellness, and maybe a captain oversight. And then KP's on the research piece. The other one, and Misha mentioned this, and it's super important. There's going to be 2 working groups. One is advisory and probably going to be 8 members or less. My intention is to use Captain Jeremy Crawford. Can I say that? Am I going too far? To be the lead on that, to work directly with me. And then we have to find from across California the right mix of firefighter members to be a part of that group. Some may be cancer survivors, some may be associated with the cancer survivor. We're going to need to talk about that and figure that out. The second group is a discussion group, and that's going to be about 20 firefighters from across the state. And the best way that I can put it is so that KP, so Kaiser Permanente, the researchers and the doctors and the nurses involved, we become culturally competent, kind of that's a cross-pollination, us to the world of oncology and how we navigate that, and Kaiser Permanente to the world of firefighters and what that means to be a firefighter in the exposures and the different worlds that we work in. Did that help?
Everything helps. Thank you.
Okay. Anything else for Misha? Anything else? I'm going to close it up. One, I want to thank you for your time. This is an awareness, and I hope the board gives full support. There's not an action to be taken. I do believe that this research project, and Misha can kick me, but for a Kaiser investment, for time and research and all that, you're probably looking at about a $600,000 to $800,000 or $900,000 project. This is one of many. I handed a handout out. That's AB 700. CPF has several studies in there related to cancer. The state funded that at $7 million in the last legislative session. This study goes hand in hand with that. And I think, Bob, did you answer? You asked a question on the UC Davis and the bands. Our commonality here is Dr. Derek Irwin, who is a PhD and a professor at UCLA. He's also a Los Angeles County apparatus specialist. He's an engineer. He became a research PhD because his brother succumbed to cancer in his mid-20s. And he's one of those people that he couldn't sit still and not do something about it. So aside from being a firefighter, he went back to school and got his PhD. the commonality in all of these studies, Dr. Irwin is working closely on each and every one of them and has a lot of oversight. The end goal in this is we in California and all California firefighters, that we can put this information together to lessen the number of cases of cancer we get, and the ones that we do get, we know more and we can catch them sooner. This is about prevention. It's about industrial hygiene, personal hygiene. And this literally is a kickoff. Misha and I were talking. I've never seen this done in California, and you all know I'm pretty active across the nation. I've never seen it done across the nation. And Misha said, Kaiser, nobody else has ever done this before. So this is really pretty groundbreaking. And all we're asking for is being a willing partner to work on this endeavor. And that's it. I'm excited about it. And I'll end with this. I know we have a wellness vote coming up. It's incredibly important. And the directions that this fire department is going to really recognize how important the health of our members is. Because it also affects their families. So I appreciate your time. If you have any questions of me, ask away. Other than that, I'm done.
Any other questions? No?
Thank you.
Thank you.
Thank you for your time.
Thank you for all your work. All right, we have another presentation item, Canine Support Program Update. We have Captain Ryan Polis here.
Shy one out there. All right.
Uh-oh, no shy ones. We got to get them all up here. Welcome.
Thank you. Well, good evening, everyone. I'm Ryan Polis. I'm captain over at Engine 65A, and I've been the A shift coordinator for peer support for the last 8 years here. Was asked to come in and give you some updates tonight, so I have some really cool stuff to bring to you. I wanted to make some introductions to start out tonight. There's one individual in the crowd in particular that stands out right now, and we're going to leave him last because I want to tell you about how he got here. Next to me here, we've got firefighter Bo Santiago, Engine 109C. He is going to be our C shift canine handler with peer support. One hiding out in the crowd is Captain Trevor Gordon, Engine 65B. He's our B shift handler for our program. And they both went through an interview process to get to where they're at. And we're still looking for an A shift one. Our process didn't generate an A shift handler yet. So we'll be making that announcement and working on that this spring. And yeah, moving forward, how did we get here? I came to you guys about a year ago, a little over a year ago, excited talking about this. We're getting ready to get it off the ground. And then I had a pretty significant off-duty injury, required surgery, knocked me out for a while. But I hit the ground, not running anymore, but jogging when I got back, working on getting back, and got to where we are tonight. There's so many people that made this happen. And I wanted to start out by introducing you to Fawn and Danny O'Neill tonight. They're with Warfighter Overwatch. They're a nonprofit here in town that does a lot of work for veterans and first responders. Their story and getting to it, it was a story of a lot of pain and injury following Danny's deployment in Iraq in the Army, U.S. Army, and pain that led to growth. And that's where their group came out of. They're doing really great things in town. And I met them about 3 years ago, was assisting a member here that was struggling and needed to get into the program for some substance abuse. And there were some financial issues at the time that I was trying to work out, and reached out to Rich Alamo with Sac City Fire Department. He's one of our counterparts in peer support on that end. And he referred me to them, called them up, and without a question asked, they met the need financially for us. So it was a couple months after that I get a text from Fawn saying, hey, I want to bring you in, and I want to have a talk with you. So I scheduled a meeting, went down there, and one of the projects they have within their organization is the Atlas projects, is where they're financing the ongoing costs of peer support program canines in the region. And they'd already started doing that with Sacramento Fire Department, and Fawn pitched it to me. She said, we'd like to do that for Metro Fire. That was where this started. This wouldn't have started, Fawn, without you calling and scheduling that meeting with me. Their generosity has been pretty incredible. So That got things running. It was a learning process all along the way. Me getting hurt slowed things down too, but we finally came down to a point where we've got some dogs. And Captain Gordon, who's hiding out in the crowd still, he's got a really beautiful, 3.5-month-old now, creme brulee golden retriever that he's training. She's not here tonight. She's a puppy still. She's not quite ready for this crowd yet. Sorry, Trevor Bo's going to beat you to the line, right? I want to introduce tonight also, though, Bo's dog, Silver. Silver came to us from First Response Canine in Concord. What went down began their process in December of this past year, and actually got one early. All the staff, he was telling me the first week he spent down there, I've got this dog. I really enjoyed this dog. He worked with a number of dogs down there, and at the end of the day, the dog that he really enjoyed that week's who he ended up with. All the staff agreed. They just bonded, and he came to us actually a lot earlier than we expected, but I think everyone said it was just the right fit. They're another nonprofit as well. Silver came to us because of the generosity of private donors out there. They give to their organization. I can say it, I've said it before, and I'll say it forever. This whole experience has been extremely humbling. How many people out there are willing to help just financially to get things off the ground and help us in the realm of firefighter mental health. And Silver's going to be going to work on Monday. It's his first day in the firehouse. He's going to be signed into 109C. He'll be C shifts, peer support canine. Ongoing, as they pledged to do, Fawn and Danny have pledged to pay all the ongoing costs associated with him. So things like food, veterinary bills, those kinds of things are all going to come out of their organization for his career here. So again, it's been extremely humbling. I can't thank you two enough either for what you've done and what you're continuing to do for our agency and other groups in the region. It's been excellent. So I want to introduce Silver. I don't know if you guys want to say hi or what you want to do. Bo, if there's anything that you want to add. Yeah, I figured that. He's a great personality. He's 2 years old. You sure can. Yeah.
Minutes is it going to take for this organization? It's on our website.
On which website? Oh, this? Oh, absolutely. We've got it all scheduled to release on, we're gonna be on Good Day Sacramento on Monday.
Okay,
And
that's what I
social
wanted
media is
to
all
hear.
going to pitch on Monday. So
Just
yeah,
as you've described, their
Yeah.
support for us needs to be recognized.
absolutely. They've been
Get it-
fantastic.
I think we got 400,000 followers on Metro's site, so
Yep.
I really want to see, because it's really incredible that you folks are throwing down like you are. Our men and women really deserve that, but thank you for.
Thank you, Director.
Yeah.
Thank you, Director.
What was it? Cream delay or what?
Creme brulee golden. Trevor.
I want to know how that happens.
In fact, yeah, she's on cat pictures as well.
I've never heard
We'll
that.
show you. Yeah.
I mean, I've eaten them, plenty of them.
Right on there. St. Louis at Christmas time. She's actually, it's a creme brulee golden retriever, correct, Trevor? And then you'll see her here. She can't, and so that's another group that I'd like to thank too, is creme brulee goldens out of Roseville is where she came out of. And that dog's actually come to us from another group here in French Quarter, For Paws to Freedom. And we'll see more on them in the near future as well.
Birdie? Yeah. Any other questions from the directors? I think there's a lot of questions happening here.
Uh,
I guess I'll ask a question.
Sure can.
So what can the board do? Like, what kind of help are you looking for?
You know, at this point, we've got all the support that we've needed. Continue to support what we're doing in peer support. I think anyone could attest.
absolutely.
It's really changed a lot of lives for the better around here. We've put in an incredible amount of work over the last 8 years, and constantly growing the resources that we offer and what we're able to do for our membership. And it's really already benefited an incredible amount of people. And we're
That's
going to continue to do that. So please, just your continued support for what we're doing.
Yeah. Thank you for all you're doing, and thank
Thank you.
you for all that you're doing. Any other questions from the board? No? Yeah, we're gotta keep bringing a dog by. Yeah. Yes. Well, great. Thank you very much for all that you're
Thank you
doing.
very much. We
Yeah.
appreciate you guys.
Appreciate everything you're doing. Thank you.
Can I ask a question?
Oh, yes, please.
Did 522 also support?
Thank you. And my apologies. Yes, so there actually has been in this program, we've got financial support from 522. We've got support from Sac Metro Firefighters Association. I can't forget Chief Green and Chief Peck as well. When Chief Harms at the time caught wind that I was working on this, he brought me in, we had a meeting, and he assigned Chief Green to assist. And then eventually that became Chief Peck as well. Couldn't have happened without them either. Just, I bit off a lot more than I knew at the time. Okay,
Good question. Thank you. Thank you very much.
thank you very much.
Good one. Oh, yeah. All right, we'll move on to our next presentation item, Wellness, Health, and Safety. Chief Peck. Good evening.
Good evening. Board of Directors, Chief House, colleagues, members of the public, Tony Peck, Assistant Chief for Wellness, Health, and Safety Division. And I'm here to give you a brief update on the division, where we're at and where we're headed and what we're going to need to be successful. But I really do want to recognize Captain Poulos. He did an incredible amount of work bringing this K-9 program to fruition, working exhaustively with Council Lavra, working with the MOU, the policies, as well as the nonprofit. So we really couldn't have done it without him. So thank you very much if he's still here. So he did an incredible job. Also, Chief Green was there during the inception. So really getting this up off the ground, did a fabulous job. So wellness, health, and safety. So if you remember, I was here about maybe 6-7 months ago. At that time, the division had not been formed. It was more of a vision, but I'm happy to say that here we are, a fully fledged division here at Metro Fire on equal footing with all the other divisions and getting the equal attention as the other divisions. And we're really motivated to start getting some wins for our membership. The presentation I have for you, I know you've seen it, and I've spoken with some of you offline and some of the information. Some of it's similar from when I talked to you last. So some of it I'm going to touch lightly on, but if you need me to elaborate or refresh, I can do that. I'll be more than happy to do that. So I do want to go down the priorities for this division. First of all, establishing appropriate staffing levels, which I'll talk about a little bit more in this presentation. Establishing a comprehensive network of wellness resources for all members. There are a myriad of resources out there, physical and behavioral, for members. So really doing all that research, vetting out those resources and bringing them to Metro Fire, and really not resting on our laurels, but actually looking at the best possible resources as we move into the future, as this landscape changes. So constantly looking for that network of resources. Ensure a safe working environment for all members through exposure reduction, PPE procurement, and safe operational practices. So when we talk about safe working environment, that's just not for suppression members on the fire ground, but that's also for our non-suppression members in our facilities. And really looking at that exposure reduction, like we've talked about here tonight, and our PPE procurement, keeping our members safe with that PPE. Effectively changing department culture to reflect a heightened focus on member health and wellness. Chief House and I've had a lot of discussions on how do we change the culture here at Metro Fire. So this is a priority with this agency when we're all gone, that it continues to be a priority, continues to be at the top of the list. And how do we get our members to adopt that mindset so as they become leaders in the organization that we can pass that torch to them? And then finally, pursuing alternative funding mechanisms. Here at Metro Fire, obviously, we're blessed with the passing of Measure O, but we know that monies can only be used for certain things, and there's a lot of different priorities. So really here in the division is rolling up our sleeves and looking for those alternative funding mechanisms. So we'll be heavily involved in pursuing grants and partnerships. In terms of our division accomplishments, I know Chief House mentioned to you a few meetings back on what we have accomplished. So I do want to touch on a few of these. The first one I'm really passionate about is initiating our district exposure reduction program. And this is a comprehensive look at our entire agency on how we're going to reduce that exposure, from station design to facilities to training to incidents, everything we do. So we've initiated that program. We're finalizing a preliminary exposure reduction policy. If you remember, preliminary exposure reduction, anything a firefighter can do after a fire to reduce their exposure. So we're finalizing that policy. So moving forward, it's really not a best practice. It really isn't an option, that this is going to be a policy, and it'll be a big haul for our leadership to make that happen and instill that ownership for years to come. Continue to enhance DECON 110's capabilities. We're now finalizing an RFP for enhanced physical exams, our new physical exams, which will include ultrasound for vital organs, advanced cardiac screening, and cancer screening. So we're finalizing that right now. Hopefully within a few weeks, that'll be done. We'll be turning that over to labor to get their approval. We'll release that RFP and hopefully in a few months, we'll award that contract. Identify a potential wellness center location. I do want to take out potential. We have identified that. That's our training building at 3121 Gold Canal. So we're in the infancy of that right now, moving personnel around, seeing how that's going to fit for us. We started the canine support program. You saw that here this evening. Implemented Radio Rebound, initiated our cancer task force, which was going to be more of an internal task force in conjunction with CPF and KP and everything they're doing, with a group that's really going to hone in on education awareness, prevention, screening, and the research and the science that goes into that. One-year goals. This is what we want to achieve in 2025. We thought about what would we be proud of as a division? What we'd be proud of in terms of what we'd accomplish in that first year. So we talked about the physical exams. We're looking at expanded physical therapy availability, visiting different agencies throughout the state and looking at their wellness programs. A lot of them are really successful starting with physical therapy. We offer that 1 day a week for 4 hours. So we're looking to expand that to 3, maybe 5 days. More availability, the more our members can get in, prevent them from being out of work and reduce those work comp costs. And not only that, but just having a happier workforce. Executing a new EAP contract. Our contract with Concern expires June 30th. So Captain Manfredi and Jeff Wells are feverishly working to get that extended or initiating a new RFP. So we'll accomplish that this year. Establish a work comp liaison program. And what this is all about, we're looking at this to basically provide 3 things. Number one is we have a lot of members who have trouble navigating through the work comp system. So having that coordinator there can help them get over those obstacles and hurdles, preventing them from being on work comp any longer than they have to be. Second of all, the human element. We have a lot of people on extended work comp. So just having that coordinator to reach out and say that, hey, we're here Metro Fire and we care, so they're not lost in the shuffle. And then finally, really to educate the membership, because there is a stigma out there that when we have delays in work comp, that HR is the culprit or HR is inefficient. So really to educate the membership that that's not the case. Like I talked about the Metro Fire Cancer Task Force, bolstering our safety officer program, which I'll talk about here in a second. And the one that we're really excited about is acquiring the liquid CO2 extractor. So as you all know, that in our safety facility, we have our washers and extractors where we bring the contaminated PPE. We put that through the extractor, it goes back to the members. So right now, when we do that, those extractors remove about 72% of the contaminant from those PPE, and that's industry standard. So now there's new technology, these liquid CO2 extractors that uses liquid CO2 to clean the PPE. And studies show that it basically removes 98% of contaminant, which is a big win for our members. Not only that, but it specializes in lithium ion contamination, which our extractors do not. So in a couple of weeks, Chief House, myself, Bobby and Brian from the safety division are going to go back east. We're going to be talking to some of those manufacturers. We're actually getting ready to launch an RFI, and this is going to be really a big task for the agency. This is going to be multi-division involved in this. So we'll have a liquid CO2 team. And so we're going to be moving forward with that. And hopefully within the year, we'll have one of those extractors. So that'll be a big win for our membership. 1 to 2 year goal, we talked about this before when I was here, is the Metro Fire Wellness Center, the one-stop shop for our members for physical exams, for physical therapy, for blood draws, for nutrition, for advanced cardiac screening, advanced cancer screenings such as esophageal disease. So that's what we're working for right now in that 1 to 2 year mark. And we'll continue to collaborate and work together on making that happen. So there's a lot of things that we want to do here in this division. There's a lot of big things. We have a lot of great ideas, a lot of things we want to accomplish. And so for right now, we're looking at what we call the gold package on where we want to be. What does success look like for this division? This isn't what we're looking for right now, but this is what we're moving towards. And I just wanted to share this with you. So when you hear us talk about this, or you see us come to other meetings and ask you for certain things, you'll have some context to that. So looking at an assistant chief, which we already have, we have our safety BC, 5 captains, and I'll explain that in a second. We have our coach, we have our safety specialist, we have 2 safety technicians, so we'd be adding 1, an administrative specialist. This is basically how it would fall out. And what I really want you to focus on is the safety BC and the 3 safety officers for A, B, and C shift. we've identified the need to have a safety officer on shift here at Metro Fire to have that 24/7 risk management mindset for our members online. And that being the case, those 3 safety officers would have 3 core duties. Number 1, they'd respond to incidents to be the eyes and ears for that safety officer and not really being pulled into the incident per se, but being able to stand back and provide for safety for that entire incident. Secondly, post-incident analysis. Every day here at Metro Fire, we have lessons learned out in the field. It is a challenge getting those lessons learned to our members, and that's something that every agency deals with. So having them heavily involved in that post-incident analysis and sharing that information. Also being our accident review officers, responding to all vehicle accidents, being highly trained, being the SME on scene, ensuring that we're getting everything that we need to get done and reducing that liability for Metro Fire. As you can see, for A shift, B shift, and C shift, there's a laundry list of collateral duties they would also be undertaking. And these are all things that any solid safety program would have. Some of these things we're doing very well in, some of these things we can do better in. So as we move forward, you're going to hear us talking more about the safety officer program and moving towards that. So as I said, that was our future staffing plan. That's kind of our gold package that where we want to be. But right now for the Wellness, Health, and Safety Division to be successful, we're looking and asking for 2-day captains to help basically spread that workload, to enhance that division of labor between physical wellness, behavioral wellness, health and fitness, everything we want to do in safety, especially with our PPE, all of the safety programs we have, the ones that we want to have, our cancer task force. Right now, to get things started, we're asking for those 2-day captains. We understand that right now for the division, it's in its infancy. We need to crawl before we walk, before we run. But we've determined this is what we need to be successful moving forward. So that's all I have for you tonight. Just want to give you a quick update on the division, where we're going, and to come to you and ask for those 2 captains positions. And I'm available for any questions.
All right. Thank you. Any questions? Director Gould.
Thank you. If we move back to the previous slide with the bold, or a couple more, that one right there. That one, is that based off of a department that currently has a health and wellness division and is being monitored and going? Is this the kind of structure that they enjoy today?
No, let me kind of back up, because one thing that's really important to us in the division, really important to me, is if we're going to have a program, I want it to have value. I don't want it to be a checkbox program. I don't want it to be a program on paper. I know there's some agencies that do have the safety officers, but for the most part, when they do arrive on scene, maybe they're kind of pulled into the incident. So we're looking to have a true safety officer who can really stand back and really value the safety of that scene and being involved in these different duties between the shifts. So this is very aggressive, and it's going to be a big challenge to make sure these safety officers are highly trained and instill that ownership in them. So that's not going to be an easy challenge, but if we're going to do it, let's do it right. Let's make sure it has value.
Yeah, I guess the other part of that question is, if they do have a structure similar to this that we could replicate in some way, is there data that suggests the impact that that health and wellness structure has on the institutional wellness that we enjoy? Like, are they saving hundreds of thousands of dollars annually in workers' comp claims or medical claims or something like that? Because I think having that data, even if it's different, but it's similar in the sense, could help us in that regard as we look at the overall cost of this for our organization. If we could look to another organization and say they did something different but somewhat similar, and here are some of the cost savings that they had, because as you know, we're not going to be able to tap necessarily directly into Measure O money. So I'm just wondering if you had thought about how that list could get institutionalized.
So like anything new that we do, we're humble. We're not afraid to use other agencies' templates. For example, San Diego has a very progressive wellness program. So we've coordinated with them, we've visited them, and not necessarily mimicking them because we are Metro Fire, but if someone has that successful template, why not? So we will definitely be reaching out and doing our due diligence as far as not only how they have structured these programs, but what data they've used to justify them.
Yeah. I know that when we saw San Diego, the city manager and that gentleman that was in charge was telling us incredible things about the impact that it had on their organization. And so I just wonder, like you said, we're Metro Fire and I get that, but if, like you said, if they've got data that suggests we're going to do this and save millions of dollars, I think that helps us as budgetary folks make that easier, a decision easier for us.
Yeah, we're not afraid to reach out. We will definitely not be working in a silo when it comes to this.
Thank you, Mr. Chair.
And I think part to answer your question a little bit too, Metro Fire has tried shift safety officer before. We've been down this road. The difference now is, right, we have put a direct priority in the organization and found with our collaboration and looking at the trips that 522 and I went on where organizations have done it well and areas of improvement. Now we're taking it to a different level to the point of where the CPF and Kaiser Permanente is seeing holes currently in the data, because as this drives forward, it just isn't really good data yet. So we're going to be mature about it and look at our own data, still continue to ask others what their data looks like. But I would say also this, the shift safety officers of yesterday is simply just incident safety officers generally for fire conditions. We're looking at it from an all risk organization and really being all risk on every avenue. It's just like taking the leap of faith and saying, we're recognizing that our partners, Orange County Fire Authority, that's doing a great job, and us will be the two of the only games in the state looking at CO2 extraction. Taking the leap there based on good data from partnerships and collaboration to say, this is a necessity, and having the courage to also put this at the top of the list of the CIP if we're going to talk about wellness. It goes in hand so the puzzle pieces go together to say we're taking this very seriously, having to mature as an organization to build this into our culture, not to drive it by policy, but because we all know that better firefighters' health and safety are going to be better responders for the public. It ties the knot. So I hear you loud and clear. We're going to continue to provide the data, but the data right now, let's be honest, is a bit skewed. We haven't done a good job historically capturing that. We're taking that on head on. The entire fire service is doing that, specifically the state of California. The asterisk I'd put next to this is that when we go anywhere, every single vendor out there knows the fire service is hungry for this. We have to caution ourselves to really do great research and not hop on just the golden ticket, and make sure it's right for our organization, right for our members, and right for all of us financially, so it's sustainable. And so that's the difference between the Cadillac package, right, of what we're really asking for, and I've heard loud and clear, is when we're adding additional positions, are they sustainable for our future? The two asks for these captains, which will come to you when we bring this, the pad to you next month. Have these on there. The Finance and Audit Committee earlier saw the budget, and it keeps that sustainability right in line with what our ask was before, because we found efficiencies there, and those are the right asks for a variety of reasons. Peer support will have a direct role with one of those captains, and then we will look into the cancer and safety side of that, which is going to be in line with the ask from our partnership from CPF and Kaiser Permanente to say they want us to be a partner in this. So hopefully that answered your question a little bit better.
Absolutely.
Yeah. Very good. Thank you. Sorry, Director Weber.
So getting back to your goals, year one, year two, I understand it's in very early stages, but do you have any of these programs, job descriptions, outlines, do you have any of that already made, or do you have to create that? Specifically, I'm looking at the work comp liaison, what that job title and classification and what that looks like.
Within the division, what we're asking for as far as positions, we have those position descriptions established. But as far as the work comp liaison, we're not there yet. And that'll be a collaborative effort on how we're going to do that. But yeah, definitely in the infancy.
Got it. And then secondly, could you work with Marnie, and I don't know if the rest of the board wants it, but I definitely want this PowerPoint emailed
Yes.
to me. Thank you.
Thank you. Director Rice.
And then Chief Beck, I saw the gold standard. Have you even thought about a timeline on that? What it would take time-wise and funding to achieve that, just to have an idea as a board? And the second part of that, I was here when we did the safety officers. We weren't ready for it. And I was, as a command officer, I was just a horrible, those guys stood on the fender of my truck. Don't do anything unless I tell you to. You know, we weren't ready for it. I think we're ready for it today. I think we've matured that way. But who ends up in those positions do a damn good job choosing them because they're going to make or break it. And last time we tried it, we broke it. And that's a big, important one. What's exciting to me on this is I remember going to the city of Phoenix probably 20 years ago and first touring their health and wellness center. And they had doctors and physical therapists. If you were a Phoenix firefighter and you got injured, you did not leave the property. You received all of your rehab, all of your treatment through the department. I'm hoping that's a portion of the vision. I'm excited about is it Gold Canal?
Correct.
Site, whatever. I like what I'm seeing here, but I can tell you, you got to do it right, especially those safety officers. If you swing and miss, or, you know, and this probably sounds horrible, you get the wrong person in there, your ship's going to sink. And it's so important. So you have my support here. Just do what I know you're capable of doing and what the chief knows you're capable of doing. You're on the right track. So.
And I appreciate that. I think that will be the biggest challenge. And I know we've had that discussion, is not only a program that really does provide value, members will see that, but picking the right people. And not only that, but investing in the training. And that is ongoing training. And that's no different than changing the culture here with health and wellness, changing the culture with how the safety officer operates. We do have data, we do have information on what that gold package would cost. But we've talked also as far as not rushing into this, really being somewhat cautious, but aggressive, obviously in certain areas like the liquid CO2 extractor, but points well taken. Thank you.
The other one, Chief, and I'll let you go. It's always important for us, the sooner we know an associated cost, the more we can process that and we can work it into our thinking, because, you know, we're thinking about a lot of different things: operational costs, administrative costs, work comp costs, contracts, labor costs. It all matters. So just don't be afraid to share that, even if it's 5 years down the road. The sooner we have an idea of this stuff, the better off you guys are.
Thank you.
Please.
Chief, you can disregard mine. I was just educated. I already have that. Okay, so thank you.
You're welcome.
Just really quick to build off Director Rice. Can we go back to the slide that shows how many positions you're looking at? And I just want to make sure I understand. So what you're looking for, and we'll be coming back. The future data is 2 captains, but what currently exists on your staffing?
So what currently exists right now is the assistant chief, the battalion chief, the coach, our safety specialist, 1 safety technician.
Perfect.
And right now we share an administrative specialist between training and wellness, health, and safety. And at some point, we're going to need our own respectively. So we'd be looking to add, in addition to what we're requesting this evening, the 3 captains for the safety officer program, as well as 1 extra safety technician and the administrative specialist. And the safety technician really is, we're at a point now where we're cleaning 15,000 pieces of PPE, because here in California, we're required to do that twice a year with an advanced inspection. And, you know, we're not even talking really about boots and helmets and all those different things. We now have our MMPs. So that's really growing exponentially with our preliminary exposure reduction policy, crews going through wet decontamination in the storm stick. We're going to see more turnouts coming in. The liquid CO2 extractor is going to require more. So we definitely envision needing an additional safety tech. And the important thing is getting those turnouts and that PP back to those members by the next rotation, because as soon as you don't do that and they lose that trust, then they're not sending them in anymore. So we really have to support that effort.
Thank you. Yes, Director.
Can you just remind me what the spread is between our current cleaning modality and this liquid CO2 extraction? Can you tell me what the spread was again?
As far as the
What's
percentages,
difference?
it's about 72, 73%
72
for
is
what we currently
use.
have,
Yeah.
and about 98% with the liquid CO2.
Okay, am I losing my mind, or is this like not going to become a massive, you know, priority for this organ? That is an incredible difference. And if we're talking about preventing cancer and we have something that has that big a difference, to me, I got to say, why isn't that moving up the budget standpoint massively? That's huge.
So I will say that.
It has. It's at the top of the CIP.
Okay, all right, thank you, because
And the asterisk next to this is that it's the only thing that removes the heavy metals.
Yeah, no, I heard that part. I'm just thinking with that big a difference, we need to do everything we can to get that sucker out here because that's not small percentages of difference for our men and women. To me, it's like, when you said it, I'm like, well, there's a priority, right? Because it's just so massive. It's not 2%. That's incredible. How long are they going to take to make one of these intergalactic O2 center thingies and get them out here? Are they already built and implemented someplace?
They do have them built.
Yeah, so Chief House has made that very, very clear that this will move to the top of that list. So this week, we're putting together that at Liquid CO2 team and moving that right direction. I know Chief House did talk about, not jumping on that golden ticket, not buying the first iPhone that's out there. So we want to do our due diligence, visit these sites and make sure we know what we're getting before we invest in that. But once we get to the point where we feel comfortable with that, that's going to definitely happen in a very quick hurry.
Yeah, let's not kill it by committee if we can, because if the science is real, it needs to be purchased and get out. That's a big difference for our men and women. Did y'all hear what he said? Looks like a DeLorean. Is that true?
Somewhat.
Okay.
All right, any other questions from the board? Thank you, Chief.
Thank you.
Great presentation. All right, we'll move on to reports. President's report. President does not have a report. Fire Chief's report.
Absolutely. What a great night. Tony, come back up here, buddy. Chief Peck. What a great night, all wellness. So I want to bring Chief Peck back up here because Chief Peck has been promoted to the rank of Assistant Chief effective February 20th, 2025, and assigned to run our new Wellness, Health and Safety Division. So Chief Peck, congratulations.
Thank you.
Yeah.
Thank you very much.
Thank you.
All right, and the last thing that I have for tonight, I'll keep it short. The 34th Annual Leukemia and Lymphoma Society Firefighter Stair Climb is happening on March 9th. This will be the second year we have done this, and we have 19 firefighters participating this year. We have our very own Director, President, ex-Deputy Chief of Operations, Brian Rice, participating. And I checked the status of the data board today. We have, as Metro Fire, moved into the #1 place, beating Seattle, the host agency, in the status board with $53,837. And of that, Chief President Director Rice is on top of the individual board. I think I heard him quote, he used 40 years of his Rolodex. I don't know that on the news, everybody understood the term Rolodex. So that is your iPhone contact list, 40 years of that. And he has an impressive, with the governor's support also noted on that data board as a contributor, donor, $37,489. So congratulations, sir. Thank you for your efforts. I know that you were asking for support, and I hope that Metro Fire supported you like we should in every avenue of this. And to all the rest of the members joining you up there, what a great tribute, and what for a great cause, that perfect timing for tonight, wellness. So thank you, Chief Rice. And that's the end of my report, unless you have any questions.
All right, any questions for the chief? Thank you, Chief. Operations report, Deputy Chief Mitchell.
Thank you and good evening, directors, Chief House, colleagues, and public. We had planned tonight to recognize one of our members in person who has reached a milestone of employment here at Metro Fire. Unfortunately, due to personal reasons, he wasn't able to be here, but I would like, however, to bring up Shift Commander Chief Green to talk about the member and the milestone that he reached, because not a lot of folks get to this point. So Chief Green, come on up and I'll turn it over to you.
Thank you, Chief. Good evening, directors, Chief House, everybody. Assistant Chief, your shift commander on A shift. We're on Plan D Delta. I had Plan A, Plan B, Plan C. We're not going to quit. The person of the hour is not here tonight. That's Battalion Chief Chris Reed. Unfortunately, he had a personal thing that took him away from work today. But we're not going to stop because everyone in this room really needs to understand what he's committed to this community and this organization since 1990. This month, he celebrates his 35th year in the fire service. As much as we would love to have him here to present him a 35-year pin, I also want to share with you just a little bit of historical context about Chris and what a career event is. I think most everyone here knows when you go into the emergency services and you spend a career, you're going to have a quote unquote career call. A very challenging call, unique call that not something everyone experiences. But on top of that, there's also administrative side of the house where this is a career event for most all of us tonight. I personally have never been part of honoring someone that's had 35 years experience, but we're going to do that tonight without Chris. So if anyone's wondering, like, how long is 35 years? I won't tell you what I was doing 35 years ago, but this is 1990. So Chief Reed started in the fire service when the Gulf War started in 1990. The first McDonald's opened in Moscow, Russia. The Hubble Space Telescope was launched into space. The 49ers beat the Broncos in the Super Bowl, extending the 80s dynasty in 1990. On a more somber note, New York City in 1990, the Happy Land Social Club fire killed 87 people. Absolutely tragic day for the fire service. Also, and this is squeaking just a touch past 1990, was a career call for Chris Reed as a firefighter in Fair Oaks Boulevard in Carmichael when the tanker crashed and burned 4 homes, and luckily did not have a significant impact on injuries in the citizens, but is really to this day an infamous fire with the American River Fire District that's transcended into our district. What Chris brings to the team on A shift of command officers, we don't have them here tonight, but it's a very diverse group. Everyone's got different talents, different backgrounds. Chris Reed is our historian. Probably the best thing he likes to do is go out to coffee to make sure that he doesn't meet with his boss in an office because he's afraid something bad's going to happen. So you take him out to coffee, and the history lessons he provides, I believe, is very sobering for everyone in this organization on the fact that we don't need to reinvent the wheel. And we talked a little bit about, the safety officer position just a little bit ago. We're going to try it again in a better way. So if any of you want to hear some great history about our community and what the fire service has done, and you want to hear about the tanker fire of Carmichael, Chris will be happy to have coffee with you. So we are going to honor him in a different way. But I do want to, in case he's watching tonight, understand that these 35-year pins are very rare. And I think that the people in this agency that see the 35-year pin the most is the standing fire chief. Chief House, how many of you been over your career?
Handful.
Yeah, not to put you on the spot, but it's
handful.
Yeah, this is a rare event. So I want to thank you all for listening to me and the time. And although Chief Reed isn't here tonight, truly heartfelt congratulations on 35 years. I did ask him the other day if he has any plans on retirement, because I'd like to see a 40-year pin. He has no plans. So thank you. That's all I have.
Thank you.
Adapt and overcome, Plan D. So that's what we do. And that ends the operations report unless there's any questions.
All right. Any questions for Chief Mitchell?
Thank you.
Thank you, Chief. It looks like we have no administrative report or support services report. So we will go to Firefighters Local 522 report. Chief Cole. Oh, no report. Thank you. All right, we'll go to committee and delegate for reports. Executive committee, we have no report. Our next meeting is to be determined. We'll go to Communications Center, JPA, Deputy Chief Eureka. Did I get it right?
Yes,
All right,
thank you.
good.
Good evening, directors, Chief House, colleagues, and guests. Joe Furica, Interim Deputy Chief of Administration. The Communications Center JPA last met 2 days ago on the 25th. Prior to that meeting, I was assigned by Chief House to be Metro Fire's representative to the board. During the board meeting, my appointment was confirmed. And the only real action that came out of that is appointment of officers on that board, with Chief Bear from Cosumnes Fire being appointed as the chair, and then the other board members, obviously myself, Chief Matt McGee from Folsom Fire, and Chief Scott Williams for Sacramento City. There were no other reportable actions. Our next meeting is scheduled for March 11th, 2025 at 9 a.m. right here in these board chambers. And that's the end of my report, unless there's any questions.
Any questions? No questions.
Thank you.
Thank you, Chief. All right, Finance and Audit Committee, Director Jones.
Thank you, Director Costa. Finance and Audit Committee met tonight. Very informative reports from CFO Dave O'Toole. You will all be receiving the mid-year budget review in the near future. And one highlight for me was the slide about comparable pension percentage of pension that's funded by our about 15 agencies that would be comparable to us. And we've asked CFO O'Toole to delve in a little bit more at some time in the future and give us a report about what are some of those factors that lead everyone. It can be a 62% funded liability up to almost to a 98% fully funded, almost fully funded. And so it'll be very, very interesting as we delve into the whys and hows, and hopefully that will help inform us to make some progressive changes. Thank you.
Thank you, Director Jones. Any questions? All right. Thank you. Policy Committee, nothing new to report. Our next meeting is scheduled for March 13th. We'll move on to board member questions and comments. And we'll go to Director Gould.
No comment.
Thank you. Director Stark. Director Jones.
A big thank you for everybody who's involved in the Citizens Academy. I had the opportunity to meet and greet our group last night. It's terrific. The energy in the room, the positivity was absolutely terrific, Chief. So thank you to each and every person who has participated and supported that.
Thank you, Director. Director Rice.
Could I just ask the board, a really good friend passed away in the last week or so, Jack Church. Yeah. And Jack, he didn't work for our agency. He was an apparatus operator on Truck 2 with Sacramento. Was very close with Jack over the years, lost a little bit of touch with him as his health slipped. He's a 58-year member of Local 522, 58 years. And I don't know anybody that served with the dedication like Jack did. And I would just, if we could close our meeting in honor of Jack, I would really appreciate that. Yes, please. Thank you.
Dr. Clark.
Yes, thank you to everyone for the presentations. Fantastic. I also echo Director Jones on the Citizens Academy. I mean, man, I plan to pretty much go to all of them because I learned it so much. And also I love the questions that the citizens are asking. The constituents are asking. I mean, they're asking some crazy questions that makes you think. No, I mean crazy in a good way. You know what I mean? And they're very informed. They're very committed. And our presenters are just fantastic. They're all over it, and so I think it's a great program. And I invite every other one of you to show up if you get a chance. And I think you will really enjoy it. The first night I went in, I was just going to do a couple minutes and because I was, I had something going on and I decided, you know what, this is so good. I'm going to stay the whole time and cancel the rest of what I had to do that night. So it's a great thing. So thank you. And appreciate your leadership on that, Chief. That's all I have.
Thank you, Director. Director Weber.
I have no comments. Thank you.
All right, thank you. Before we close, I just want to say thank you for everyone that came out tonight. A nice full house and a lot of great presentations. And I think Director Rice starting it off with kind of where we are and the studies we're doing on the cancer and then leading into what we're doing with health and wellness is just perfect. And it shows where we're going as an organization. So thank you, Chief. Thank you again for your leadership. With that, before we close and to go to closed session, we will like to take a moment of silence for Jack Church. Thank you. Close to go to closed session. All right. Meeting is back in session. So we'll go to our chief counsel, Larva, on the closed session report out.
Okay, thank you, Director Costa. The board met in closed session under the closed session agenda item set forth in the agenda for consultation with district council and the cybersecurity manager. No reportable action was taken. Thank you.
All right, thank you, sir. That brings us to the end of the agenda. Our next meeting is March 13th, and we are adjourned.